So in the PCT, a lot of things are reabsorbed. It can be via paracellular mechanism or via transcellular mechanism. If it is coming between the cell, it is paracellular. If it is coming through the cell, it is called as transcellular reabsorption. 100% reabsorption of glucose happen, amino acid happen, 80% of phosphate and bicarbonate, 70% of calcium, 67% of urea, potassium, water, sodium chloride. These are happening in the PCT. Okay. Now, why osmolarity does not change? If glucose is reabsorbed, amino acid is reabsorbed, so why even when it passed beyond the PCT, it is remaining same? Because water is also reabsorbed via osmosis, via solvent drag. So much amount of water will be absorbed to nullify the change in the osmolarity, so that when the fluid passes through the tubule, when it is passing through the PCT, the concentration does not change. Equal amount of water is also reabsorbed. This is the reason that even when fluid passes through the tubule, osmolarity does not change. Is this point clear? Okay. So water is reabsorbed via solvent drag, or you can say via osmosis. So this is the fate of water. Now, what is the fate of sodium and chloride? See, there are two types of reabsorption. If you remember, in almost every cell of the nephron, the basolateral membrane, I've told you there are two membranes. One is luminal or apical, other is basolateral membrane. The basolateral membrane are decorated by a pump called as sodium-potassium pump. Almost every cell. And this sodium-potassium pump is the primary transporter using its own ATP. And with the help of this ATP, when something else is reabsorbed, it is called as secondary active transporter. And when both are coming in the same direction, it is called as symport. And if one is coming in the same direction, other in the opposite direction, it is called as antiport. So maximum thing in the PCT are absorbed by secondary active transporter. Suppose if I am going to have lunch and three of you are coming together along with me, and I am giving you treat, I am paying the bill. So I am like primary active transporter. Now you are taking the lunch or dinner, whatever. Okay, it is not free. I have to pay that. So this is active process, but secondary active process. It is not the passive. So similarly, in the basolateral membrane, sodium-potassium pump is there. It keep on reabsorbing the sodium. So there will be negative gradient in the cell. Yes or no? Yes. This will cause more sodium reabsorption from the luminal side. And along with that sodium can come glucose, can come amino acid, can come lactate, can come inorganic phosphate by the help of sodium glucose co-transporter, sodium amino acid co-transporter, sodium lactate co-transported, sodium inorganic phosphate co-transporter. So maximum things are happening like this only, that both are coming together. I have given treat and you people are coming together with your girlfriend, suppose that. And suppose you are coming in and your ex is going out in the same party. It is called as exchanger or counter transporter, like sodium proton exchanger. Sodium is coming in, but proton is coming out. It is counter transporter. So proton is secreted in the PCT, and 60% of sodium reabsorption is happening by this antiporter, sodium proton X. This is not your X, it is exchanger. Okay. So suppose I have given you party and you are coming, suppose your X is also there and she is going out or he is going out. So this is a type of counter transporter, NaHX. Okay. So sodium glucose, sodium amino acid, sodium lactate, they are co-transporter, but sodium proton exchanger, counter transporter. So all these are involved in sodium exchanger on the luminal side, on the apical side, because on the basolateral membrane, almost all sodium is by sodium potassium pump, maximum absorbed by sodium potassium pump only. But if they ask you on the luminal side, there are so many transporter, which is responsible for maximum sodium absorption on the luminal side, then it is sodium proton antiporter. Am I clear? Is this point clear? Maximum things are absorbed by this mechanism, secondary active transporter. And how water is absorbed? Which aquaporin is present on the PCT? It is aquaporin 1. Water is absorbed via osmosis to balance the same. It is called as osmosis. Wherever sodium, there is water. Wherever there is sodium, there is the water. It is called as osmosis. Yes or no? This is called as osmosis. This is called as solvent drag. And for that, you have a aquaporin 1. That is why the fluid which is leaving the proximal convoluted tubule is isoosmotic. It is isoosmotic. Am I clear? This is a fate of, you can say, sodium and then chloride, water in the PCT.